Dissociative amnesia represents one of the most intriguing and complex psychological phenomena in the field of mental health. This condition, characterized by the inability to recall important personal information that cannot be explained by ordinary forgetfulness, affects countless individuals worldwide. Unlike typical memory lapses that occur naturally with aging or stress, dissociative amnesia involves significant gaps in memory that are typically related to traumatic or stressful events. The condition manifests as a protective mechanism where the mind essentially blocks out memories that are too overwhelming or painful to process consciously. The etiology of dissociative amnesia is deeply rooted in psychological trauma. When individuals experience severely distressing events such as physical abuse, sexual assault, combat exposure, natural disasters, or witnessing violence, their psychological defense mechanisms may activate to shield consciousness from unbearable emotional pain. This protective response, while initially serving as a survival mechanism, can become problematic when it prevents individuals from accessing important aspects of their personal history. The severity and duration of the amnesia often correlate with the intensity of the traumatic experience, though individual variations in resilience and coping mechanisms play crucial roles in determining outcomes. Clinical presentations of dissociative amnesia vary considerably among patients. Some individuals experience localized amnesia, where they cannot recall events from a specific time period surrounding the traumatic incident. Others may develop selective amnesia, retaining some memories while losing others from the same time frame. More severe cases involve generalized amnesia, where patients lose all memories of their entire life history, including personal identity, family relationships, and acquired skills. Systematized amnesia represents another variant where individuals lose memories related to specific categories of information, such as all memories associated with a particular person or location. The diagnostic process for dissociative amnesia requires careful clinical assessment and differential diagnosis. Mental health professionals must distinguish this condition from other causes of memory loss, including neurological disorders, substance abuse, medical conditions, and normal stress-related forgetfulness. Comprehensive psychological evaluations, medical examinations, and sometimes neuroimaging studies help rule out organic causes of memory impairment. The diagnosis relies heavily on clinical interviews, standardized assessment tools, and detailed examination of the patient's history and symptom presentation. Treatment approaches for dissociative amnesia emphasize psychological intervention and trauma-focused therapy. Cognitive behavioral therapy helps patients develop coping strategies and process traumatic memories in a safe therapeutic environment. Psychodynamic therapy explores unconscious conflicts and defense mechanisms that contribute to memory suppression. Eye movement desensitization and reprocessing therapy has shown particular efficacy in treating trauma-related dissociative symptoms. Hypnotherapy and other specialized techniques may be employed cautiously to facilitate memory recovery, though ethical considerations and potential risks must be carefully weighed. The prognosis for dissociative amnesia varies significantly depending on multiple factors. Some individuals experience spontaneous recovery of memories, particularly when the underlying trauma is addressed and emotional healing occurs. Others may require extensive therapeutic intervention and may never fully recover all lost memories. The presence of strong social support systems, early intervention, and patient motivation for treatment generally improve outcomes. However, the recovery process can be lengthy and emotionally challenging, requiring patience and persistence from both patients and their support networks. Research continues to expand our understanding of dissociative amnesia and its underlying mechanisms. Neurobiological studies have identified brain regions involved in memory processing and trauma responses, including the hippocampus, amygdala, and prefrontal cortex. These findings contribute to developing more targeted therapeutic interventions and improve our comprehension of how psychological trauma affects neurological functioning. Ongoing research also explores the relationship between dissociative amnesia and other dissociative disorders, seeking to identify common pathways and treatment approaches. The impact of dissociative amnesia extends beyond the individual patient to affect families, relationships, and broader social functioning. Family members often struggle to understand the condition and may experience frustration, confusion, or guilt regarding their loved one's memory loss. Educational resources and family therapy can help address these challenges and improve overall treatment outcomes. Social stigma surrounding mental health conditions may further complicate the situation, emphasizing the importance of public awareness and education about dissociative disorders. Prevention strategies for dissociative amnesia focus primarily on trauma prevention and early intervention following traumatic experiences. Building resilience through stress management techniques, maintaining strong social connections, and developing healthy coping mechanisms can reduce the risk of developing dissociative symptoms. When trauma does occur, prompt access to mental health services and appropriate therapeutic support can minimize the likelihood of developing chronic dissociative amnesia. The condition also raises important ethical and legal considerations, particularly regarding recovered memories and their reliability in legal proceedings. Mental health professionals must navigate these complex issues while maintaining appropriate boundaries and ensuring patient welfare. The debate surrounding the accuracy of recovered memories continues to evolve as research provides new insights into memory formation, storage, and retrieval processes. Understanding dissociative amnesia requires recognizing its complexity and the profound impact it has on individuals and their families. This condition represents a fascinating intersection of psychology, neuroscience, and human resilience, demonstrating both the mind's capacity for self-protection and its vulnerability to overwhelming experiences. As research advances and treatment approaches continue to evolve, there is hope for improved outcomes and better quality of life for those affected by this challenging condition.